Good day, my name is Generic De La Torre, a BSN 1I student and Group A in the course Health Assessment, and I'll be doing a breast self-examination. But before we dive into the actual procedure, let's talk of its important first. So generally, examining the breast help us to understand what is normal and what should we feel when touching our breast, so that if we notice a change in our breast that seems abnormal, or if we notice one breast is different compared to the other, we may want to report it to a physician or a doctor so that they can further address what we had detected, or that is deviating for the normal findings. So breast self-examination should be performed every month. So it is important that women should do this constantly, because women are high risk of breast cancer, so that they can detect whether they have the symptoms of a cancer or any particular disease that correlates in our breast. So it's very important, because when we're familiar in how our breasts usually look and how we feel about it when we touch it, we can detect what should be normal. So for women, if they menstruate, breast self-examination should be done 1 week after their period starts. So that's it. So now let's do the actual procedure. So of course, the first step that we're going to do is to inspect our breast, and by inspecting our breast, we will be needing a mirror. So we should find a mirror that is enough to see every aspects of our breast so that we can assess it properly. So now we're going to proceed in assessing it. So the first thing that we want to consider in doing this assessment is of course to find the mirror. We're going to stand undressed, assuming so from our waist to our large mirror, and of course we're going to first put our arms relaxed on our side, and of course we're going to start inspecting, looking for any changes in size, in shape, or position, or any changes on the skin of the breast. So our breast should be same as the color of our abdomen, which is what I can see, and of course there's no change of size, and its shape, it's both symmetrical, and of course it's flat, and its position is even with our chest, which is expected through male patients. So generally our breast is good to go after inspecting it. So now we're going to inspect our nipple, and in doing this, we want to look for any sores, peeling, or any changes in the direction of our nipple. So looking for those, I can see that there is no peeling, sores, and of course the direction is outward, which should be in my age. And of course, we were now going to gently squeeze our nipple to assess if there are any discharge, and there should not be discharge. And if there is, we may want to be concerned with it. So we now going to put our hands to our hips and going to press down to tighten off the chest muscle. We want to turn side to side so that we can inspect the outer part of our breast. So there is no as usual lumps or any unusual enlargement or any unsymmetricity that I can detect while doing that. So now we're going to place our hand or we're going to bend forward in the mirror, and we're going to roll our forward to tighten our chest muscle. And of course, we'll go with our best. We're going to fall forward, and as it falls forwards, we're going to look for any changes in shape, contour of our breast. So since there's no unusual contour or shape, we're good to go to clasp our hand. We're going to now bend. So we're now going to assess its outer portion. So from what I can see, there is no unusual bumps or unusual size. They are just symmetrical. So now we're going to place our thumb, our forearms, tissue surrounding our nipple. We're going to pull outward toward the end of our nipple. We're going to repeat that as well at the other side, so that this can assess the elasticity of our nipple, and it should be go back to its original position immediately. And of course, if there will be any discharge or any excess discharge in our nipple. So we're now done assessing our breast in the mirror. So we're going to proceed in assessing our breast in the shower. So the first thing that we want to do here is to place our left hand in our hip, and of course to reach our right hand to feel the left armpit. Okay, we're going to consider every aspect of the armpit or the axilla so that we can palpate. And of course, to detect if there will be any lumps or any palpable lymph nodes. We're going to go all the way down to our ribs. And of course, we're going to do this both sides. We're going to inspect also our collarbone, our supraclavicular fossa, and our infraclavicular fossa. As I have said, we're going to do this bilaterally. The rationality of doing this, because this area have lymph nodes, and we want to see if there are any palpable lymph nodes, because if there are, we should be concerned with that, because there should no be palpable lymph nodes. So since so far there is no palpable lymph node, we are good to go. There is no thickening, there's no lumps that I have detected. We may want to raise our one arm. We're going to start with our right arm and place it behind our neck or our head to spread out our breast tissue. And of course, we're going to use the platform of our other hand or our finger. From our other hand, we're going to press it gently from our brow line to our collarbone, and the pattern is up and down pattern, or it's like a vertical pattern. And we're going just to continue this pattern until we cover the entire breast. We're just going to detect as well as the same as in our assessment if there are thickening, palpable lymph nodes or lumps. Of course, making sure that we have double checked our axilla, and of course our ribs. Of course, as I said, we're going to do this bilaterally. Double checking, of course. In doing this, it is important that we had checked every portion of our axilla and our breast, so that we're not missing out any lumps or any bumps. Even though it's small, it's important we should detect it as early as we can, so that it is still not severe and we have detected it immediately. We can do intermediate preventive measures, of course, to avoid any further complication. So now we're done with assessing our breast and the shower. Now we're going to proceed in assessing our breast in lying down or in supine our position. So now we're going to assess our breast in a lying down position. So the first thing that we're going to do is to, of course, to lie down. And we're going to place a small pillow or our folded towel. But in my case, I'm going to use a folded blanket, which has the same function, but we're going to put it in our shoulders. And we're going to put our right hand behind our head. And we're going to place our left hand on the upper portion of our right breast. We're going to start here at the collarbone, and our fingers should be flat. And we're going to do the vertical method or the up and down pattern method. Good. In doing this, we're going to palpate our right breast, starting from the collarbone downward, little by little, until we reach the area below the breast. Going to move our fingers slightly mostly to the middle and move back, following it in an up and down pattern until we have covered our area of our right breast. Make sure that our armpits are covered, of course. And we're going to do it, of course, bilaterally. And see now this to our left arm, and we're going to assess our left breast. And now we're going to start palpating from the collarbone. So, same as the other assessment and the other patterns, we're still going to detect if there are any palpable lumps or any bumps or any masses, of course lymph nodes that we can detect. Should cover every aspects of our armpit. Of course, going down to the rib. Now it's done. So now we're going to do the circular method. Going to for this, position it the same position as the other method. I'm going to now at the outer edge of our right breast, we're going to move our around the breast in the circular motion to a smaller and smaller circles, gradually toward the nipple. Going to consider also our underarms and upper chest. And it should be done bilaterally. As I said, the smaller and smaller portion, and doing this pattern. Just you may press the nipple for this, Georges, but since we've done it in the first one, we can now proceed. But now we're now going to proceed in the other side, placing again the rolled towel. Starting from the outer edge, covering every part. Our breast in a circular manner, smaller and smaller portion. Make sure that every part is covered. the nipple, areola. So yeah, we're done with the circular motion. So now we're going to proceed in assessing the wedges method. As usual, same position, outer edge of our breast, and we're going to move our fingers towards the nipple, checking the whole breast, and covering a one small wedge section at a time. We're going to check, of course, our underarms area, and of course the upper chest. Of course, we're going to see it on the other side. Since it's already covered, we're now going to proceed at the other side, transferring our pillow, our folded blanket below our shoulders, and now going to proceed in doing this wedges position. And starting again from the outer edge to the nipple. As I mentioned, chest should be included. The upper portion of our collarbone. So that concludes our self-breast examinations, and from what I have palpated and inspected, there are no any abnormal findings that I had detected. There's no tenderness, there's no unusual shape, there's no palpable lumps or any bumps that I had detected, indicating that there are no signs of any breast-related illnesses. And it is important to take note that if there are any abnormal findings that you have detected during this assessment, especially in women, it is important to seek for help to your healthcare provider so that they can provide so they can give you advices, and of course to address um, what is the status of your breast so that they can do an early preventive measures to prevent further complications. So that includes the breast self-examination.